The CDC Advisory Panel meets today to recommend who will be first to get a COVID vaccine once approved by the FDA here in the U.S. Hospitalizations in the U.S. are closing in on 100,000 for the first time, and health officials are warning of a rising death toll through the winter. ABC News medical contributor and infectious disease physician Dr. Todd Ellerin is here with more. Dr. Ellerin, thanks for being back with us. How do you think this CDC Advisory Panel decides who gets the first vaccine?
Right. So it's going to look like immunization impact. Okay, what's the most impactful recommendations? Meaning, who's the most vulnerable? So probably those patients in nursing homes, chronic care facilities, of which there's several million in the United States. And then the frontline providers, they may not be the most vulnerable, but they're the ones that are, we are taking care of COVID-19 patients every day. So we're the most exposed. Those may be the first two groups. I want to just give you a sense that there's over 20 million frontline providers, healthcare workers, and then after that, we're probably going to see essential workers, the people who have to work, can't stay home, where there's about 80 million, and then there's about 100 million people in the U.S. that have chronic medical conditions. Half of those, or 50 million, are over 65. Those are probably going to be the first few groups that the CDC prioritizes.
All right. And the FDA chief has been summoned to the White House for a meeting with the president's chief of staff today, reportedly over frustration about how long it's taking to authorize a vaccine. How does the process work, and what do we know about how long it usually takes? What do you make of this meeting?
Wow. I mean, I'm so impressed. Remember, we just started the phase 3 trials where we put these vaccines in people, either the vaccine or the placebo. Those just started over the summer. So I think that this process has gone incredibly well. I can't believe that the vaccine, that we're going to be able to roll up our sleeves soon and start to begin to get this vaccine before the end of the year. I think it's remarkable. And then to know that most Americans will likely be able to be vaccinated in 2021. I really can see an end to this epidemic in the U.S. and potentially the pandemic around the world, before the end of 2021.
Now, is there a difference between the way, it seems like there is, between the way it's approved in Europe versus here? It seems their system may be a little bit faster. Is there a way to speed things up here?
Well, I mean, I think, again, we want to do this right. The FDA has to scrutinize all the data. They have to give the authorization. We are trying to speed things up. I'll give you the fact that the CDC is meeting today for a vote. Usually the CDC will make recommendations after the FDA gives authorization. So they're reversing it, so they're ready. As soon as the FDA gives authorization, we'll already have the CDC recommendations, and then those vaccines can be distributed around the country to the states. Right, so we can implement and start giving vaccines.
More important to be careful than first, I suppose. And health officials are also now saying that vaccinations, regardless of what we just said, they still could start as early as Christmas, even going through the full FDA approval process. But both Pfizer and Moderna have 2-dose vaccines. So what does that mean from a practical standpoint?
That is important. When I say we're going to begin vaccinating by the end of the year, and we're hearing that about 30 million doses should be distributed before Christmas. Now, remember, it's 2 doses, so that means you don't really have your robust immune response till about a week to 2 weeks after the second dose. So we're going to start vaccinating. Let's say if you have 30 million doses, then you can vaccinate 15 million people, may get their first dose before the end of the year, but they're still not going to be protected till the end of January, or 3 to 4 weeks after they receive their next dose. So 2 doses, 3 to 4 weeks apart, then you are generally immune about 1 to 2 weeks after that. So it does take some time. It is a process.
We'll still need to be patient there as well. There are also now reports that coronavirus could have infected people here in the U.S. as early as December of 2019, a year ago. What do you make of that?
Well, I think what it tells us that this is an insidious virus, that by the time the first cases were seen in the U.S. in the end of January, that it was really widespread in our communities. To say it another way, even if we had shut down the borders between the China and the U.S., as soon as we heard that there were cases it's already in the U.S. We already would have had an epidemic. It may not have reached the degree that it had. Maybe we could get better control. There's no question about that. But the virus was here even before we heard about it from Wuhan.
And I got a few viewer questions I wanted to throw your way. One viewer tested positive for COVID, has a 5-year-old and a 3-year-old at home. What kind of precautions can this person take to try and anyone else in this situation? How do you keep from spreading it to your kids? What kind of precautions can you take to try to prevent that from happening? And what should you look out for when trying to monitor them to see if they are sick without risking contaminating them?
Right. This is a very important question. So remember, first of all, one thing, if they're a single parent, it's that much harder. If there's another parent in the home, then you obviously want the parent who's infected to be isolated in their own room, and you'd like the other parent to take care of the kids. If they're a single parent, and remember, it's not just like you can just bring the kids somewhere else, because the kids have a good chance of getting infected as well. Remember, the household contacts are the highest risk of close contacts. So what you really want to try to do is keep everyone separated as much as possible. You want everyone to be masked whenever they're near each other within 6 feet. Everyone should be wearing masks. At the same point, you'd like the kids to not be interacting if it's possible. I mean, they're 3 and 5, and so it's difficult. You can't just leave the 3-year-old to their own devices. So it is challenging. Remember, if the kids have any symptoms, any type of fevers or cough, you want to get them tested. But you also ideally would like to get them tested even if they're asymptomatic, because remember, they're close contacts. So they may have the virus. It's possible that they may have spread the virus to their parents. So you don't know which way it goes. So there's a lot of things here. If there's any questions, you want to reach out to your healthcare provider.
But it's not always a guarantee, right? Just because you have it doesn't mean you definitely gave it to your kids, or vice versa. They may still not be contaminated. So that distance is important.
Great. I mean, that is a very important point, Diane. Yeah, you often don't know where you get it from. And in fact, when you look at households, typically only about 15% of household contacts ever test positive. So you're right, it's not a guarantee. You can't be sure. That is the importance of underscoring testing and keeping everyone separated, the masks, et cetera.
And then in terms of managing symptoms like fever and breathing issues, which this person is experiencing, how do you manage those at home, and how do you know when it's time to go to the hospital?
Well, certainly if you have trouble breathing, you can't keep that at home. You have to make a phone call and talk to your primary care provider. If you think it's worse than that, if you really have trouble breathing, that's when you need to seek out the emergency room. One thing that is important is, though people do have trouble breathing sometimes, you really want to try to monitor your oxygen. If there's certain devices on our phones they're called pulse oximeters. You can go out and purchase a pulse oximeter. If you can monitor your oxygenation, that is important. I understand most people may not be able to do that, but you don't want to leave trouble breathing up to your own devices. You don't want to just stay home. If you have trouble breathing, you need to get help.
All right, Dr. Todd Ellern, always great to have you. Thank you.
Take care, Diane.
And if you have COVID questions, feel free to send them to me on Twitter at Diane R. Macedo. I will ask as many as I can right here on the show.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.